Hello everyone, and welcome to another edition of Eye Care Today. I'm your host, Dr. Thomas Kislan, and we're coming to you today from our new Tannersville location, our brand new Tannersville location, located right on 611 in Tannersville, Pennsylvania, next to Friendly's. Our phone number here is 570-421-3342. And for those of you watching in the Hazleton area, Hazleton Eye Specialists is our office in that area on the Airport Beltway, 570-453-2020. And as always, check us out on the web at www.drkislan.com. Today I am joined by one of the newest doctors in our practice, Dr. Corinne Belanger. Thank you for coming and joining us today. Dr. Belanger is a local talent, local star of the Tannersville area, decided to come back and practice in the area where she grew up and went to high school and served the people in her area now. So thanks for coming on the show, and thanks for coming back and practicing in the area and providing your expertise to the people in this area. So tell me a little bit about yourself. Tell the folks out there watching a little bit about yourself.
So I was born and raised in the Poconos. I went to Pocono Mountain East High School. Always had a strong interest in sciences and biology, mathematics. Went to Westchester University outside Philadelphia, and from there went on to Pennsylvania College of Optometry, and where I got my Doctor of Optometry degree. And I'm back, and it feels good.
Yeah, it's great. You started in July of 2017.
Yep.
The great thing is I think that you bring so much to the practice, so much knowledge and ability to see patients of all ages. And I know you have some interest specifically in pediatrics. So tell the folks out there a little bit about pediatric eye care, why kids should get their eyes examined, and at what age.
So pediatric eye care is extremely important to have normal development for a child. So a child has to be, in order for a child to meet all developmental milestones in their life, they have to have the appropriate vision to do so. So one of the biggest things is early screenings for these children. We start here at 6 months of age, where we are able to look at ocular health. We can use lights and scopes to be able to determine if the child has an abnormal prescription, so if that child would need glasses. All of this.
So let me jump in there. So everyone out there is wondering, how the heck can you see a 6-month-old? They can't read a chart, they can't talk, they can't verbalize what they're seeing, and even probably perceive yet what they're seeing. How the heck do we examine 6-month-olds?
We're able to use lights, and the actual eye itself does a rebound light reflex for us. So the reflex of the light that we see in the child's eye is what gives us the information we need. Not only can we tell the amount of prescription in the eye, or the prescription the child would need, or if there's anything abnormal, we can tell by the light reflecting back to us if there's any misalignments of the eyes. So if one eye is out further than the other eye, and this would be critical in early development of the child.
And isn't there a certain condition we look for when the light reflex is off in one eye than the other? Is a certain type of cancer that we're looking for?
So that's a retinoblastoma cancer. Most common eye cancer in children. So that's a huge one that we can look for, just early onset screenings, and that's one of the things we look for and check for.
So kids get screenings at the pediatrician's office. What's different with that versus what we do here?
Right. So there's a lot more to ocular health than just the visual acuity, or how many letters or rows can you read on a chart. And at the pediatrician's office, they're reading charts, and based on the number that they can read on the chart, that clarifies them either normal or abnormal. And in some instances, it can be correct, but in other instances, we here check for other things. Binocular vision, so are the child's eyes working together appropriately? Is the ocular health, are the lids normal? Are there any ocular allergies? Is there a lazy eye that the prescription's high and we wouldn't know about from just what they can read? So there's a whole slew of things, and there's a lot more to the exam than just how many lines or letters can the child read.
Pediatrics is so interesting. The question I get a lot is, are all babies born with blue eyes?
Right.
Is that true?
It is the melanosis inside the eye, so the amount of pigment inside the eye develops over time. So the child might be born with a lot less pigment than what they will develop. So to some extent it is true. A child's eye is just lighter.
And what if we detect maybe the child sees well, but they're having trouble copying from the board, they're having trouble maybe with rights and lefts, so B's and D's, P's and Q's. Is that a vision thing?
So we can do perceptual eye testing or perceptual testing, and that can determine if the child's struggle in school is eye related or not. So there's different components to that. One of the biggest ones is binocular vision. So is the child able to use both eyes uniformly to read, to copy from the board, and all those things that they're struggling with in school can be related to how the eyes are working together.
And so it's not just seeing clearly, but the message has to get from the eye to the brain and back. Is that right?
Correct. So as long as if the child can see clearly, their visual acuity is good. However, the child could still be seeing double vision. Or the child could have eye strain or a lot of eye fatigue. And that's not related to the acuity. That's related to how the eyes are moving together. And that can be huge in the development for the child and how well their child's performing in school.
And that's something that if we detect can actually be helped?
Correct. So our practice, and luckily for the area and the community, our practice is offering vision therapy. Vision therapy is a new and upcoming therapy. However, not many places are doing it. There's no one in our area that's doing it for these children. And that's something that we can offer to these people.
So I want to talk a lot more about vision therapy, but unfortunately we have to take a quick break here. You're watching Eye Care Today, and we'll be right back. Hello everyone, welcome back. You're watching Eye Care Today. I'm your host, Dr. Thomas Kislan, and we're coming to you from our brand new Tannersville location, located on Route 611 right here in Tannersville, Pennsylvania, next to Friendly's Restaurant. Our phone number here, 570-421-3342. For those of you watching in the Hazleton area, our Hazleton office is Hazleton Eye Specialists, located on the Airport Beltway. Our phone number there, 570-453-2020. And as always, catch us on the web, www.drkislan.com. I'm joined today by my colleague, Dr. Corinne Belanger, new addition to our practice. As we talked about in the last segment, local talent who decided to come back and practice in the area. And a couple things we forgot to mention in that I think is pretty cool. We'll give them a shout out, your dad and uncle helped design and build this fantastic office, right?
Absolutely, they're the best. So they have the two companies, Build All Construction and Northeast Masonry, and they did a great job, didn't they?
Yeah, fantastic. And I think it was your uncle credit. The beautiful stonework on the front desk behind us was his idea. We were just going to go with a regular desk, and he suggested the stone. I think it turned out great. So shout out to them. The other thing we forgot to talk about is you're a member of the Lions Club in the area here. Tell us about that.
I joined last year, so September of 2016, so a year and a half now. I was inducted into the Tannersville Lions Club. I was the first woman to be a member there, so that was big for them and big for me. The Lions Club is very specific to vision and eye care, and that's their number one supporting thing. So to have me on board and to have them, be a supporter of me, it's really changed the community and the dynamics, and we've all been able to help each other out. So it's been really good.
Tell the folks out there about the vision screenings that the Lions Club.
So the Lions Club partnered with the Center for Vision Loss in Monroe County, and that's at the Burnley Workshop in Saylorsburg. And we go around and screen all children of preschool, kindergarten age, and that they come back with a form that says either they should, get get a routine exam or if they had any abnormal findings. So that's been huge for getting these kids screened and early intervention.
And while we're talking about kids, in the last segment we kind of let off a little bit about vision therapy. So it's not all about glasses, seeing with glasses or contacts. There's sometimes a problem with the message getting from the eyes to the brain and back, and you were starting to talk about vision therapy. So tell the folks out there exactly what vision therapy is and why it's important.
So vision therapy is a newer therapy where, we're one of the first practices in the area to offer it. Not only is it for children, but it can be for adults that had traumatic brain injuries, any type of severe concussions. But for children with, with any type of binocular vision disorder or what we call ocular motor disorder, meaning the eyes aren't moving together correctly, they're going to struggle with reading, copying from the board, things that are going to hurt them in school, and it's really going to be a lifelong struggle. So vision therapy offers the opportunity for us to provide a unique program per each child or per each adult to help their eyes relearn how to work together.
That's a great point that we sometimes forget about. You said adults. Traumatic brain injury is something that a lot of people don't think of, but I think we have 5 or 6 patients now in our therapy program for traumatic brain injury. These patients were referred to us by local neurologists. Tell folks out there a little bit about traumatic brain injury and what we can do to help those patients.
So lots of studies have shown that traumatic brain injury causes basically a disruption in how the eyes and brain were working together prior to that. This includes concussions, any blunt trauma to the head, car accidents, sports injuries, anything that has caused any type of brain or damage. This has caused a miscommunication between the brain and the eyes. So we have to relearn everything.
And in general, I know every patient's different, but how long does a course of treatment sometimes take for these patients?
So we typically start between 8 and 12 weeks, where we do 1 therapy session per week, and the program is not specific to one program works for all. Each patient gets a unique program. So we sit there and we design a program that's going to be unique to what the patient is struggling with, whether it's headaches post-concussion, blurred vision post-concussion, anyone that's struggling with anything as far as reading or can't go back to work because they are having these troubles. In an 8 to 12 week program, we can usually correct and get the patient on the right path.
It's almost like personal training for the eye.
It's personal training for the eyes.
And in these patients with traumatic brain injury, a lot of times their insurance helps. Insurance will cover that.
Correct. Yeah. So that was a big thing as of in the last couple years. It was never used to be covered by insurance, but now it's recognized as something that's very unique. It's similar to physical therapy or occupational therapy, and vision therapy is now being covered by most major medical insurances.
Is that the same for kids also?
Correct. So not only for traumatic brain injury, but for children that are struggling with what we call convergence insufficiency or ocular motor disease, their insurance companies are covering this treatment as well.
And that's the one thing our staff is great at. They'll help the patient walk through the insurance things that need to be walked through and find out if the patients are eligible or not for vision therapy and how many sessions they're eligible for. I want to go back to the Burnley workshop a little bit. You mentioned the Monroe County Center for Vision Loss is there. What else do they do?
So the Monroe County Center for Vision Loss, it's an organization that helps basically anybody with any sort of low vision needs. So they do the school screenings and they do the preschool screenings. That's a big part of them, but the other huge part is providing help to those with low vision and driving people to doctor's appointments, helping with visual aids and telescopes, magnifiers. They do support groups for people who have loss of vision or low vision. And they provide activities and monthly events for these patients. So it's a great way for people that have low vision or have any type of loss of vision that's affecting their daily life to to be able to work with other people that have the same complications in life.
They're a great group, and when we come back from the next break, I want to talk about low vision a little bit, and I want to give a little shout out to the Burnley Workshop. This is an organization that survives basically on donations and also from some funds from the state. And as we all know, state funds are dwindling and dwindling for organizations like this, and every April there's something called the April Showers Ball that goes on at the Stroudsburg here in the Poconos and raises money for the Burnley Workshop. So if anyone has any interest in the April Showers Ball, would like some information on how they can donate to the Burnley Workshop, please feel free to contact our office here at Stroudsburg Eye Specialists. So we're going to take another short break here. Thanks for watching. You're watching Eye Care Today, and we'll be right back. Welcome back, everyone. You're watching Eye Care Today. I'm your host, Dr. Thomas Kislan. We're coming to you from our new Tannersville location, located on Route 611 here in Tannersville, Pennsylvania. We're located right next door to Friendly's here on 611. Our phone number, 570-421-3342. For those of you watching in the Hazleton area, our Hazleton office is located on the Airport Beltway, 570-453-2020. Our website, www.drkislan.com. Call, email with any questions you may have about our shows or any other questions, or to schedule an appointment to see one of our great doctors. I'm actually joined today by one of our fantastic doctors, our newest addition to our staff here at Stroudsburg Eye Specialists, Dr. Corinne Belanger, a local, as we were talking in the last couple segments, born and raised in the Poconos, came back to practice in the area. So thanks for joining me today. Great to have you. We were talking in the last segment about the Monroe County Center for Vision Loss and some of the things they provide, services, and you started to touch on something called low vision. So we talked about pediatrics, and now we're going to go to the other end of the spectrum. As we age, just as other things happen, our eyes can not work as well as they used to, and patients can lose vision from certain diseases, and then they need help seeing. So probably one of the biggest conditions we see as we get older is macular degeneration. So tell the folks out there watching a little bit about what macular degeneration really is.
Macular degeneration is a disease of our central vision. So it's a disease where deposits and proteins and lipids build up over time under the macula, and it leads to central vision loss. So there's obviously different stages to the disease. There's not really any specific studies that show who gets it, why they get it. We know Caucasians are more at risk. We know people with fatty diets are more at risk. Smoking, people that smoke are more at risk. But then sometimes it's just idiopathic, and it happens and affects people. Typically, the early stages of macular degeneration, there's no signs. People don't know there's anything going on, and that's why we are super big promoters and supporters of early, every year eye screenings, eye exams, even if you're not having any trouble. Because diseases like this, there's no symptoms and there's no pain associated until it gets to the later stages where we start to notice visual distortions and vision loss, and there are some intervention things we can do. We have great retinal specialists that work with our practice to, if there's wet macular degeneration, there's treatments for that, and basically early intervention and routine yearly screenings are the best way to get through.
As far as patients who get macular degeneration, you made some great points. White, female. I usually say, light-skinned, light-haired, light-eyed patients are a little bit more prone. And you mentioned smoking. I just want to, everyone says quit smoking, quit smoking, quit smoking. But, you're right, smoking almost a 10, 11 time higher risk of developing macular degeneration versus other segments of the population. So if you smoke out there, please stop. We'll just say it again. And you touched on early intervention. You're right, we do a lot of screenings in the office to help pick that up. And talk about a little bit about nutritional supplementation. There are some vitamins and omega-3s and things like that that we can prescribe in the office, that we actually sell here in the office, that patients can get to help with that.
So there's different vitamin formulas that have, tons of studies have been done that helps really slow down the progression of macular degeneration. So if you come in our office and things are looking maybe a little suspicious, or we call you a macular degeneration suspect, we recommend these vitamins that tons of studies have shown that slows down the progression, and they're very important. So along with that, and we say high green leafy diets and lots of vegetables has really helped. Omega-3s are helped with their anti-inflammatory properties, and they help with the lipid deposits under the macula that aren't supposed to be there. So there's a lot of early intervention type things that we can do to help slow down the progression.
You mentioned omega-3s, a company called Physician Recommended Nutraceuticals. You can Google them and take a look. They have one product called iOmega Advantage, which is a highly concentrated, what's called a triglyceride form omega-3 with lutein and zeaxanthin that was actually developed by 2 retina specialists down at Wills Eye Hospital in Philadelphia. And you're right, this has been shown to help slow down the progression of the disease. That being said, we do all that and patients can still end up losing vision. They come to us then for help. So explain what low vision is. When patients no longer can see with regular glasses, what else can we do?
So low vision is when your visual acuity and your daily life functions, we can't obtain that through regular glasses. We have magnifiers, which we can help you be able to read. So it's a magnifier that you would put on your reading material. We can offer telescopes, and telescopes would be kind of supplemental to your regular glasses to help you see a little bit farther away. Lots of support devices and systems for people with vision loss, whether it's peripheral vision loss or central vision loss, and that's where low vision comes in. And the Center for Vision Loss is a huge supporter of low vision devices and low vision services.
And they can help walk patients through possibly getting funding and help on some of these devices?
Absolutely. They can help people that can't afford the devices or get it covered through the insurance companies. Like I said, they offer driving services so these patients can get to their doctor's appointments and things like that.
Talk quickly a little bit about what is a CCTV?
So a CCTV is it's a big screen, and it helps to magnify things that are on the computer. So a lot of our new devices that we have are even offering low vision services on the device, and that's just to magnify everything and to use your device or your mobile device as a tool and an aid, and the CCTV is similar to that. So
there's lots that can be done now to help patients who've lost vision.
Absolutely, and it's tough to not fall into a depression almost from it, because there's so many support systems and devices that can help you, and so many people that understand and definitely offer services.
So I think that the message out there is whether you're young or old, here at Stroudsburg Eye Specialists, we can see you, help your vision, whether it be glasses, contacts, refractive surgery. We didn't even get to talk about refractive surgery today. And also, if there are problems such as glaucoma, macular degeneration, we can screen for that and treat that if necessary. You mentioned we have a great retina specialist, Dr. Patel, here on staff. Dr. Bucci is our cornea specialist. So we can really help anyone out there that has any visual concerns. I just want to thank everyone for watching, and thank Dr. Belanger for coming on. Dr. Belanger is accepting new patients. She sees patients of all ages, does have a special interest in pediatrics and also low vision. We also didn't get to mention you do home visits. If there's anyone out there who can't get into our office, she will come out to the home and do home visits. So that's a new service that no one else in the area is offering, and Dr. Belanger also goes to nursing homes to see patients. So if you can come to us, we will come and see you. She takes pretty much all insurances, Medicare, AmeriHealth, GHP family. So please give our office a call, let us help you. We thank you for allowing us to come into your living room today and spending some time with us. Thank you, Dr. Belanger, for joining me today. You've been watching Eye Care Today. I'm your host, Dr. Thomas Kislan. We'll see you next time.